In a healthy person, arteries should be very elastic and very compliant. In other words, that means that they should have the ability to expand easily, and they should also be able to recoil easily. This ability of your arteries to be elastic and compliant keeps your overall cardiovascular system healthy while also decreasing your chances of heart attack and stroke. However, on the other hand, when your arteries are stiff, your heart has to work harder because there's less compliance, and with that decrease in compliance, there's going to be an increase in vascular resistance. Unfortunately, the combination of the two is going to cause your blood pressure to go up because, once again, there is an increase in the overall resistance. And so the blood pressure has to go up in order to continue to do its job of perfusing your 37 trillion cells. And so this is why it's important to understand that high blood pressure is not a disease. In fact, in this scenario, it is your ally because it can be your early indicator that there is an increased resistance and increased stiffness in your arteries. Your blood pressure should be looked at as a sign and an indicator, something that's warning you. And so you don't want to see blood pressure as a disease and as something that you have to medicate and treat to bring down. Now, once again, although high blood pressure is not a disease, it is an early indicator that you could be at an increased risk of stroke and other vascular conditions. In this video, I'm going to go over a study that showed how vitamin D supplementation radically decreased arterial stiffness in just 4 months. And I'm also going to show how you can use this information to lower your blood pressure and also decrease your chances of having a stroke and or other health conditions. Stay tuned. What's going on, family? This is your brother Edward Williams, licensed physician assistant, founder and creator of Health by Any Means Necessary, and I want to welcome you to our YouTube channel. We talk about all things practical health improvement, fasting, and insulin resistance. So if you're new to the channel, go ahead, hit the subscribe button, hit the alert notification. That way you can be notified when I release a new video. All right, so let's get into this study. All right, so this was a study that was the first of its kind, and pretty much what this was a randomized controlled trial that took 70 African Americans. They were all between the ages of 13 and 45. They were all in the category of being overweight or obese. They all had low vitamin D levels, which in this study they classified low being less than 20 nanograms per milliliter. And they all had some degree of arterial stiffness. So in order for them to assess the arterial stiffness, they used a non-invasive diagnostic procedure called the carotid femoral pulse wave velocity. And pretty much this is a diagnostic procedure that the American Heart Association considers to be the gold standard as it pertains to measuring arterial stiffness. So this is pretty much a procedure that measures the pulse wave activity from the carotid arteries, which are located in your neck, all the way down to the femoral arteries, which is a major blood vessel that supplies the lower body with blood. When the heart beats, it generates a waveform, and with healthy heart and vasculature, there are going to be fewer and smaller waves created. So this test essentially measures the speed at which blood is moving. And in this case, fast is not good because it indicates an increased severity of stiffness. So the higher the number, the stiffer the arteries, and the stiffer the arteries, the pulse wave velocity is going to be higher. And so when we see a higher reading on this pulse wave velocity, that indicates a higher risk of cardiovascular disease and particularly stroke. So the participants were broken up into 4 groups. So the first group was a group taking 18,000 international units per month. And this breaks down to being equivalent to 600 international units per day. The next group was a group taking 60,000 international units per month, which breaks down to being 2,000 international units per day. The next group after that was the group taking 120,000 international units per month, which breaks down to being 4,000 international units per day. And then you have the placebo group, who was not taking vitamin D at all. So this was done for 16 weeks. And as a side note, it should be noted that the doses that were given were only given one time a month. They were not given on a daily basis, which from what I've seen and what I've researched will grant you a better result as pertains to increasing your vitamin D levels. I don't recommend taking a large dose over 50,000 international units at one time, because from what I've seen and from what I've researched, you're not going to be able to absorb all of that at one time or be able to use it. So I recommend using smaller doses on a daily basis or larger doses, still below 50,000 international units at one time on an every other day basis or on a weekly basis. Let's continue. But even with all that being said, let's look at the results. All right, so let me briefly explain what you're looking at right now. So over here, the white group is the placebo group. The group that is with the black dots, that's the 600 international units per day group, which also is the equivalent of 18,000 international units per month. And then you have the darker group or the grayer group, which is the 2,000 international units per day. That's roughly going to be the equivalent of 60 international units per month. And then you have the 4,000 international units per day, which is the equivalent of our 120,000 international units per day. And so once again, we talked about how all of the participants started off at less than 20 nanograms per milliliter as pertains to the vitamin D. And so right here, we're able to see the exact vitamin D level for those groups. Now, this is the average. So on average, the participants in the group that was taking the placebo started out with a 15.9 nanogram per milliliter vitamin D level. The group that was taking 600 international units, which is not much at all. 600 international units is not a lot at all. But that group started out with average of 14 nanograms per milliliter in the beginning of the study. And then the group that went on to take 2,000 international units per day, they started out at 15.9. And then the group that was taking the most on average started out at 13.3. And so you see that this group that's going to end up taking the most vitamin D actually started out with the lowest average of vitamin D levels, nanogram per milliliter. Now, this is week 0, so this is right in the beginning where everything starts. Within 8 weeks, look at this, within 8 weeks, now remember, they consider a desirable or deficient to be anything less than 20. So within 8 weeks, we see that all of the groups, with the exception of the placebo group, are now within a desirable range as they see it. But let's go through it group by group. So the placebo group, they went from being a 15.9 with a slight increase to being a 16.1. The group that was taking rough on average 600 international units per day went from being 14 up to 21.1, which is a 7-point increase. And then the group who was taking 2,000 international units per day went from being a 15.9 all the way up to 30.5, which is almost a double increase. And then you have the group who was taking 4,000 international units per day. They doubled and they went up to being 35%. So they more than doubled, 35.7 points as far as their vitamin D levels. And this is only within 8 weeks. 8 weeks of taking vitamin D, they're able to see that increase. Now, once again, 600 international units per day is not much at all. In fact, I recommend on average 5,000 international units per day. Now, let's go on to see what happens in 16 weeks. So in 16 weeks, the placebo group, they have a slight increase of 0.7 from the previous 8 weeks, which was 16.1. And then the group that's taking 600 international units, they don't really move much. They don't really move much. Once again, 600 international units is not much at all. I mean, you're barely getting any sun exposure. You're barely taking anything as far as supplement goes, but you're barely moving the needle. And then the group who was taking 2,000 international units, they saw another bump, 6-point bump from a 30.5 up to a 36.0. And then with the group who was taking 4,000 international units, they actually saw a slight decrease. They went from being a 35.7 down to a 34.8. And so, once again, I believe that this slight decrease has to do with them taking this one large dose at one time versus taking 4,000 international units per day consistently. I believe from my research and also from my just clinical studies that if they were taking 4,000 international units on a daily basis, this level would be higher. However, when you take that large dose at one time, just once a month, you know, this is 120,000 IUs at one time. You're not going to use all of that. You're not going to absorb all of that, and you're not going to be able to utilize all of that at one time. And so much of that 120,000 international units will be wasted. So remember, when it comes to the pulse wave velocity, the higher, the stiffer. Okay, so higher numbers actually mean stiffer arteries. The lower, that means that you're going to have a decrease in stiffness. So let's look and see what happened with the groups. So this axis right here represents the change in carotid femoral pulse wave velocity. So the baseline is 0, and this is going to be the placebo group. So after 8 weeks of taking a placebo, so not doing anything, just going on about their life, we actually see that the stiffening of the arteries actually progressed. And so within 16 weeks, they had a 2.3% increase in the stiffening of their arteries over 16 weeks of just doing their regular life. And so that means that the arterial stiffness progressed. All right. 2.3 is a lot. We're talking about stiff arteries. We're talking about the hardening of the arteries. We're talking about losing the elasticity and the ability of your arteries to recoil upon demand. This is a 2.3 increase in stiffness. And so can you imagine what that would look like by the end of the year? So let's now look at the group that was taking 600 international units per day. Once again, 600 international units per day is not a lot at all. However, what we see is that instead of a 2.3% increase in stiffness, we only see a 0.1% increase in stiffening of the arteries. Now, the way to really look at this is that the natural progression of this person would have been a 2.3% increase of stiffening of their arteries. However, because they were taking a baseline level of 600 international units, they were able to stop the speed of the progression, which would have been a 2.3 increase in the stiffening of the arteries. They were able to stop that and actually slow it down to the point where after only 16 weeks, the stiffening of the arteries only increased by 0.1%, which is very good. That's a very good turnaround as pertains to decreasing stiffening. Now, let's look at what the 2,000 international units per day group did. So, for this group, after taking 2,000 international units on average per day, they were only to not only halt the progression of stiffening of the arteries, they were actually able to reverse the stiffening that was done. So we're no longer even positive. We're now looking at a negative 0.2% decrease in the stiffness of their arteries. We're talking about remodeling your arteries. We're talking about structural repair. We're talking about, if this was an actual medication, this would be a blockbuster medication. If there was a procedure that can actually do this in a safe way, this would be a blockbuster procedure. However, we're talking about vitamin D, which is why you're not hearing about this, because it's such a cheap and practical way to radically improve your overall cardiovascular health. We're talking about a game changer, a complete game changer. 2,000 international units per day, negative 2% decrease in arterial stiffness, which is amazing. Now, the group that took 4,000 international units per day on average saw a whopping negative 10.4% decrease in arterial stiffness. That is huge. That is a complete game changer. That makes a huge difference in your overall mortality, morbidity. You're definitely going to decrease your blood pressure with that. You're definitely going to drop your chances of having a heart attack or stroke with numbers like this. And once again, this is only 16 weeks. This is only 16 weeks. This is amazing. So I hope you all truly understand What you just saw in this study, in this research, was something as practical and sustainable as vitamin D supplementation. So you all know I can go on and on about this, but I hope you get the overall message that I'm trying to convey. Stiffer arteries leads to worse outcomes as pertains to overall cardiovascular disease. Once again, particularly in the case of stroke. And so when you see your blood pressure being higher, especially the diastolic number, don't see that as something that you need to treat with medications. Don't see that as something that you need to treat with some kind of magical berry or a gimmick. Take that as an indicator, take that as a warning that you are at an increased risk of some type of cardiovascular event, which is not a good sign, but it's a very helpful sign because you can now make an intelligent decision about what you want to do with that information. See your blood pressure as a window into your arteries. That's how you should see it. You should see it as a sign. You should see it as an indicator. You should see it as you getting the ability to look inside your arteries and seeing the actual health of your arteries. Your numbers represents the stiffening of the arteries. It doesn't represent a blood pressure that's a disease that you need to treat with medication. Don't just treat it with medication because then you're going to actually miss the warning that it's trying to give you. So make sure you understand this video. Make sure you understand the things that you saw. Also, make sure that you understand where your vitamin D levels are at. Check out the other video where I give advice and recommendations on how much vitamin D levels I recommend you taking. I'll just give a quick overview right now. I recommend, well, first, if you're deficient, how deficient are you? If you're grossly deficient, then I recommend you taking a loading dose of 30,000 international units per day for the first 3 to 4 days, and then dropping that down to 20,000 international units for the next 4 days, and then bringing that down to 10,000 international units for 14 days, followed by a maintenance dose of 5,000 international units for the next 8 to 16 weeks until you're able to get your labs redone. Now, once again, if you're my patient, I'm going to also take into account your weight because that's also going to change it. If you weigh more, then we're going to have to increase the doses that we're going to be giving you. Also, if you are interested in getting your hands on the best vitamin D on the market, then make sure you click the link below. We are currently having a sale on our vitamin D bottles right now. You can get enough for the entire year at an incredibly low price, so you don't want to miss that. Overall, please make sure you understand what we just talked about. We just went over. If you have any questions, put them below in the comments. I'll try my best to get back to it. But make sure you understand this. Make sure you share this video, and make sure you subscribe to the channel, like the video, and I'll holler at you later. All right, peace.